Hello, everyone, and welcome to the Wealth of Health news segment. On today's episode from the Mail Online, contraceptive pill taken by millions is linked to brain tumors after warning is issued over jab. Hello, everyone, and welcome to the Wealth of Health podcast. My name is Ahmed. I'm the Chief Exec of Echelon Health, and with me, as always, is Dr. Paul Jenkins, consultant physician, endocrinologist, and medical director.
Very warm welcome to everyone.
Paul, we're discussing something that's been on the market for tens of years. The contraceptive. This is an article from the Mail Online, and it talks about how one of the most common contraceptive pills that has been taken by millions is linked to brain tumors. So, how do you even start that episode?
It's a great controversial.
I know.
Daily Mail.
I know. Well, and once you read through it, it turns out, okay, you can't just slap a line like that. That's very
they can, and they have.
Of course they can, but it's just
great headlines,
hyper sensationalism. But nonetheless, it is an important issue, and it is something that almost the majority of women are taking for a number of years. So can you put some context behind this article or behind this
hopefully yes
headline?
So I think the first thing, the contraceptive pill has been transformative since it's developed in the 60s, and it remains the most effective form of contraception. So it is easy. It is easy to take. It's very, very effective. Yes, and in general, it is extremely safe. Yes. Okay. However, there are some caveats to it. So there's two types of contraceptive pill, broadly speaking. There's the combined one, which contains both estrogen and progesterone. Yes, those are the two hormones which control the female cycle, released by the ovaries during different times of the menstrual cycle. Or the other type of the contraceptive pill is just progesterone only. The progesterone only one works by a variety of means. It slightly thickens the cervical mucus, so sperm can't penetrate to cause fertilization. Some of them, and the type that they are referring to in this article, can also inhibit ovulation. They feed back on the master gland, the pituitary, which is my particular area of interest, which is a tiny gland behind a couple of inches back from the brain, from the eyes, and controls all of the glands in the body. The thyroid gland, the adrenal glands, the ovaries, and in men, the testes, for the production of hormones. And that sends the signals down to the ovaries in the correct order throughout the cycle to induce ovulation, release of an egg, and the menstrual period. So this pill, this type of progesterone in it, can feed back and switch off these signals. And it also acts on the lining of the womb, so it's less likely to accept any fertilized egg. So it's an effective form of contraception. This study shows that if you take it, women taking it for more than 5 years have been shown to have associated with a slight increased risk of a benign brain tumor. Yes.
Okay.
So, and the type of brain tumor it is associated with is called a meningioma, which arises from the meninges, which are the lining of the brain, which cover the inside of the skull and protect it from the brain tissue underneath it. So you can get a benign tumor from these meningioma. They are benign. If they grow a lot, cause pressure effects. So you get a slowly enlarging ball within the brain, which clearly isn't good enough, or isn't good news. But they're very rare. Yes,
how
with this tumor, so they're estimating that around 70,000 women would need to take this pill for one of them to develop a brain tumor.
Okay,
so that would require surgery. So that's a very small number.
Yes. That is yes, except for the one person who might get the brain tumor.
Yes, but I think
that's always the case.
Yes, but you've also, if you stop this pill, then the risk seems to go away on this study within a few years, or within a year, quickly.
Okay, so benign. So it's a non-cancerous tumor
Correct. It's not
of
going
the
to
brain.
spread and what we call medical word metastasize, go to the lungs, the liver,
Mm.
and cause death.
And also, it may not grow.
Absolutely, yeah.
So if you say
Meningiomas,
one in 67,000
yes,
may get it, and even if they get it, it may not grow, and the solution could be just to leave it there, like it is with a
absolutely.
number of
We
benign
detect
tumors.
meningiomas relatively commonly in
Really?
asymptomatic individuals.
Okay.
Yes, it's a well-recognized phenomenon because if you image and you scan people, you will detect incidental abnormalities, and one of them are these meningiomas. And we would frequently, you just like all things where you know they're benign, you just keep an eye on them,
Wait and
and
see.
you wait and see, and you see, do they develop? Are they growing? You monitor, and then once they reach a certain size, or depending where they are, because clearly there's various rather sensitive areas within the brain. So depending which part of the brain they might be growing close to and putting pressure on, that would
Hmm.
influence the decision as to whether or not surgery was warranted.
Okay. So just if you read the title, you're like, oh my God,
Yep.
women are dropping everywhere. But actually, it's 1 in 60. That's just context. 1 in 67,000, and even that 1,000, it may not be. They might not need an operation at all, and
Yeah,
it's a
well, they
benign
said
tumor.
that in this it was 170,000 that
Yeah,
would require surgery.
or that would require
Yeah,
surgery. Okay, one in
but
70,000.
but I think yeah, it's a very low risk. I think there are other risk factors associated with the pill which are more, you know, people need to be more aware of.
So I think it's very important to understand that because I would say 70% of people are just going to scan over the title. They're
Yes.
not because there's so much they want to catch up on the news, and there's so much news out there. So you just scroll over the title. Oh, okay. Well, the pill is associated with brain tumors now. This is now it's been burned in your brain, and that is what what you think about this issue. So it's very important to kind of put some context behind it. But since we are talking about the pill, uh, let's talk about the pill. So I've been reading and listening, and I think so. So, for example, what age should women start to take the pill if they want to?
I mean, just going back, Ahmed, well, about people would read the headlines and just
Yes,
accept that as it. Well, that's the whole point of these podcasts, is to try and clarify and give people a
yes,
little bit
right,
of
exactly.
proper, unbiased, scientific medical context behind them. So coming on to your question about the pill, well, that's very variable because it depends for the indication with which it is given. Yeah, so if a woman, young lady, girl wants contraception, then the
Hmm.
pill can be a very and is the most commonly used means of preventing unwanted pregnancy.
Right.
So so it's extremely effective for that. I, in my personal practice as an endocrinologist, often prescribe it to young women with severe irregular or heavy periods, or
Okay.
for a condition called polycystic ovary syndrome, which is a very common
Because a
condition.
completely different use or benefit for the pill, then, rather than just
Correct.
to stop
By
unwanted pregnancy.
modulating the hormonal levels and to sort of slightly smoothing them out. And if you use particular type of pill, brand of pill, it can reduce the male hormone levels, which are high in polycystic ovary syndrome.
Okay. Why do you need? I mean, that's purely an ignorant question from my side. Why do you need to regulate? Why do you need to give the pill for for that purpose?
Because again, it depends on the symptoms of
Right.
somebody. So you're always going to ask the patient what bothers them, what their symptoms are. But
Hmm.
if you have a young woman who has too much male hormone, and so they're troubled by increasing hair on the face,
Right.
upper lip having to
Hmm.
shave, some women have severe facial hair, so socially they find that upsetting. Hair on the rest of the body, severe acne,
Hmm.
thinning hair, male pattern hair loss.
And
So
this is
for those
because
factors, you have determined and measured that their hormone levels, male hormone levels, are high. Then a particular type of the pill, actually called Yasmin, has the progesterone component of it. In
Mhm.
addition to the estrogen, the progesterone component is actually a small dose of an anti-male hormone. So it can be very
Right.
effective in blocking the effects of the male hormone. And that often is a first-line treatment for me. But I think that by far the commonest use of the pill is for contraception.
Okay. And what is do we know the average time that a woman or young girl would be on the pill for?
Well, if they're tolerating it,
Mm.
many of them, while they're sexually active until they're wanting to start a family.
Okay.
So it
And
can be certainly easily be 5, 10, 15 years.
and because the article touches on that, is the risk that it really increases after continuous use for 5 years.
Yes. Yeah.
Okay. So when they stop taking the pill in order to have a baby, for example, the fact that they have been taking the pill for such a long time, does this have an impact on their fertility or how quickly they get pregnant?
Yeah, absolutely.
Okay.
It can do because the pill is the combined pill, which contains estrogen, has a high level of estrogen. It is
Right.
lower than it used to be. When I first started in medicine, it was probably almost double, not quite double the dose now. Yes, so the level of the dose has come down, but it is still what we would regard as pharmacological dose. It's
Hmm.
significantly higher than the amount of estrogen the body and your own ovaries would make, because it's got to be high enough to feed back on the pituitary gland to switch. So the pituitary gland says, whoa, guys, there's a lot of estrogen around. We don't
Mm-hmm.
need to work. We don't need to tell the ovaries to work. So it switches off the signal from the pituitary down to the ovaries.
Hmm.
Yes. So that's how it exerts its contraceptive effect. Yes.
It's the
But
same like with testosterone.
if you're on too much of it,
If you
but
take it,
no,
if you're on too much
only
testosterone, yeah.
exactly as we have
Yeah.
discussed, if you're taking in the gym,
Mm.
high levels of anabolic steroids. Yes. So in the woman, if the pituitary has been asleep, basically it's gone into not quite a deep coma, but a
Mm.
deep, deep sleep because it hasn't had to work for 5 years, 10 years, it's going to take some time for it to wake up. And it can frequently take up to a year for it to slowly, when you stop the pill, for it to slowly wake up and for
Okay.
normal menstrual cycle to recur. Sluggishly, it gets going again. It fires up the furnaces, and the hormone levels start secreted in the appropriate manner and amounts
Are there any other side effects?
of
What
of
are
the
the
pill.
side effects of the pill,
Yeah,
generally
very
speaking?
much so. Very much so. So
Okay.
the biggest side effect of it, it can exacerbate migraines, the common one. So if you're
Okay.
prone to migraines, the pill can exacerbate the frequency of that. So that would be a contraindication if you severe migraines. It
Mm-hmm.
can cause high blood pressure. So you always need your blood pressure checking before starting and then when you've started the pill. And then the biggest risk factor is that this high level of estrogen does make the blood a bit more sticky. And so you're more prone to
Oh,
blood clots. Yeah.
okay.
So so the blood clots in the legs, the so-called deep venous thrombosis,
Mm.
DVT, which
DVT.
happens, especially if you're then immobile or had a leg injury or
Mm.
on long distance travel,
Mm.
flight travel, and you can't move your legs. So basically, blood just pools in the veins in your legs, can't circulate around, is more prone to a clot. But the biggest risk in young women on it is that if you get one of those blood clots, it can occasionally be dislodged. Yes, and there are quite a high proportion of people have a residual connection between the right and the left side of the heart. Yep. And you have
Mm-hmm.
a hole in the heart, which normally doesn't cause you any symptoms, but it can go from the venous side of the circulation, this blood clot, cross through to the arterial side, and then it whizzes around the body and gets lodged in the brain and causes a stroke. So
Whoa.
that's the biggest risk, although still very low chance of it. But the biggest risk of the pill is there is an increased association with stroke in young women.
Would you say this is as common as the brain tumor that we're talking about in the article?
It's very uncommon, but not unheard of. Absolutely.
Okay.
Yes. And
But
so if you have, for any women weighing up the pros and cons, because all medicines can have side effects.
of
I
course.
think that needs to be established, and people need to, if they are thinking of taking a medicine, especially long term, you need to weigh up the pros and cons of that for you. Yes, and it's an individual choice. So clearly, the pros of this are, it's easy and very effective contraception, and the cons of conceiving if you don't want to. Yes, has to be a major factor. Yes, the cons of it, or the risk factors for these associated side effects. Well, if you already have high blood pressure, you wouldn't take the pill. If you already have a high prevalence of migraines, suffer with migraines, you would be considering not to take it. If you have any family history of clotting disorders, if your mother has had, DVTs, yes, or strong history of strokes at an early age in the family. If you're a smoker, we come back to our smoking. But if you're already a smoker, your blood tends to be thicker already.
Right.
So you don't want to increase the risk
Increases
of that.
the risk.
If you are overweight, significantly overweight, that's another risk factor already for causing DVTs. If you have, getting more than 35 years in age, it seems to be, again, a relative contraindication to it. So I think
Sorry,
all of these is just.
What was the last one about 35 years
If
of
you're
age?
older women.
You shouldn't be on it.
No.
Oh, okay.
This is because I think it's important. These are pharmacological doses of estrogen, so they're much higher than the dose of estrogen we would give in form of HRT, which is hormone replacement therapy. So you're trying to mimic the natural levels of estrogen, not make them so high that they're going to switch off the pituitary.
True. Okay. So the most common ones are the migraines.
Probably migraines, yes. I
Okay.
mean, there's some non-specific ones. People say, well, estrogen can, at some extent, progesterone can cause fluid accumulation. So women are concerned weight gain. Yes, they get puffy legs, breast tenderness, enlargement. So that can be probably the most common reason for not. Can be mood changes because you are changing with the hormones. So that hormones influence all of our moods. So that can be an important factor. But then of the more, I suppose, objective physical side effects would be migraines, blood pressure. But the one that can be potentially fatal, we have to say, and the women are warned about it, or it is on the warning sheet, is the risk of stroke from blood clots. So if you already have a predisposition for blood clots, that's what you would, or risk factors for that, that's what you would consider against. And then, but everybody makes an informed choice.
Well, how that's a good question. How informed is the choice? Do you think? I mean, we have time, you and I, to sit in this podcast and break everything down and talk about it like this and all of that. When you're at the doctor's clinic and you ask, well, first of all, if you want the pill, does everyone go to a doctor to get the pill?
Yeah, very much so. This is a prescription only, but for the reasons that I've said.
Yes, of course. But do you think they actually sit and talk with the doctor like you and I are talking right now to that extent and understand everything there is to know and the risks and the pros and the cons and before they make a decision? Or is it you want the pill? Okay, check 1, 2, 3 boxes. Here's a leaflet, goodbye.
Well, I think it's a bit of both, Ahmed. But, doctors, if you prescribe a medicine, yes, it's up to you and legally responsible, medically legally, to make sure that that patient is safe to have it. Yeah. So doctors would certainly check the blood pressure. You would be medically legally culpable if you gave a pill to somebody with severe high blood pressure.
Right.
Yes. If they're, this is pretty routine because they're so widely prescribed. And this is not, you're doing this for every prescription. This is, just at the start of the prescription, which that one may take sort of 5-10 years.
Of course.
And, everybody now has an annual review with the GPs. That's another sort of semi-legal requirement to review their medicines. And so because we all change with time and our bodies change, our requirements change, our risk factors change to determine if it's still suitable for you. But at the beginning, yes, doctors would check. Certainly if somebody's very overweight, they'd be very less keen to prescribe it, and they would check the family history of blood clots. So I think there would be some, good basic checks done. Yes.
How do you make a study? I mean, I'm referring to one of the article. How do you make a study and then conclude that the 1 in 70,000 women who had this tumor that requires a procedure, they got this tumor because of the pill?
These are association studies, so you always got to have a slight, just be slightly wary. They're not so robust. Yes, because the definitive study is you would get is a longitudinal prospective study, which means you would start with, say, 10,000 women of the same age. Everything about them would be the same as much as you can, and you'd divide them into two groups. Yes, and one of them would take this pill, and one of them would not. All other factors being equal, you would then follow them up for 5, 10, 20 years. And then you would see the prevalence or the new incidence, the new rate of brain tumors in those taking the pill compared to not. So that's the most robust scientifically form of study, but that's clearly not possible. Yes.
And that's not
So
that
what
study.
if? I'm so sorry.
That's not that
No,
study
no.
we're
So
talking
this
about
study
in
has
the
shown,
article.
they looked at the medical
It's an
records of
association.
some 8,000 women who had been taking this pill and found that there was, they claimed, increased number of them with a meningioma compared to the background population. But you
So
haven't got all other factors equal.
exactly.
So it is an association. So you need to, therefore, it's less robust, the data. So you need to then corroborate it with plenty of other studies.
This is a correlation is causation kind
Correct.
of study.
Correct.
Okay, well, this is much wider and much maybe separate topic, but there are hundreds of these every day
Absolutely.
that you read about that deduct
Absolutely.
and conclude and mention. How on earth should someone trust these or believe them or even do some checks to
Yes.
understand the background of it? I mean, if I didn't ask that question now, I wouldn't have known. And
Yeah.
it's different. Has there been a different study, for example, about the link between smoking and lung cancer?
Oh, I think that is well established.
Exactly. So I think that the correlation is
Yes.
causation here is very obvious.
Yes. Yeah, I agree. But I mean, there is another study showing that perhaps the same in this one about the brain tumors,
Hmm.
yes, of an injection of the same medication. So this
Okay.
same type of progesterone had also shown a slight increased risk of meningioma.
Right.
So
And I
it's
have
really, it's with time, you get more studies coming in, you get a consistent feel of it. I mean, look, going back, but with lung cancer and smoking, yes, it was an association study. Yes, and
right.
clearly the tobacco lobby were trying to dismiss it.
100%.
So, so you can't dismiss all association studies because that's epidemiology. That's how we become perhaps aware of them. Yes, but you have to take it, with a great pinch of salt. And as you say, if you read the papers every week, coffee's good for you. No, next week coffee's bad for you.
Yes,
You can have a
exactly.
bit of fat, no fat, or this or
Yeah,
that.
chocolate, not chocolate.
Yeah,
Wine, not wine.
exactly. White
It's
wine,
just
red wine,
yes.
alcohol, this, that. So those sort of studies are very soft. There's so many factors that could be influencing the end uh, measure, which in many of those is cardiovascular disease, a heart
Mm,
attack risk. Yes.
yes.
Well, we all know there's so many factors of that. Are people who, drink a glass of red wine more keen on their health, do more exercise, less exercise, associated with smoking, sedentary jobs, all of the other factors, trying to tease those into what's really responsible, and the degree of risk is very tricky.
Yeah, because there are too many variables,
Yeah,
way too
exactly.
many variables
Yeah,
to be able to narrow it down to
yeah.
a single source. Okay, so let's talk about something a bit might be a bit more useful than the undecisive article of what the risk is. Okay, so what is the alternative to the pill? If the pill is not an option, what is the alternative?
Other forms of contraception, barrier contraception, so condoms. Yes,
Right.
not nearly as effective, risk of splitting. Yes, the IUD,
But have no side effects.
no, it has no side effects. No,
Okay.
but they are not as effective. So in contraception, so you need to be aware of that.
Mm.
And then there's the IUD, the coil, intrauterine coil.
Risks, benefits.
Can be very effective. Some women don't want it. It's a slightly invasive procedure, can be uncomfortable, but can be effective. Or is effective, not can be, is very effective. But these are, again, especially in a young woman, considering contraception for the first time, all pros and cons that the GP can go through, or family health planning clinics, which a lot of we'll discuss.
Okay. What would you say? And I think we can even close the episode on that. What would you say if you have a young woman sitting in front of you and asking for the pill? What advice would you give?
Well, if it's for contraception, I would do, as I have said, go through the risk factors of it. So assuming that they have no risk factors, and I think the risk of them having adverse effects are very low, but you've always got to counsel someone that there is that risk. And for them to make the decision, the majority of women will have already thought that they want effective contraception, so would want to take the pill for its convenience and effectiveness.
Okay.
And the vast majority of women taking the pill take it absolutely fine.
Yes, with no problem whatsoever.
Yeah. So
Okay.
again, I don't want people going away scared and say, "Oh my goodness, we must stop the pill." Yes, it's just to consider. But a lot of the risk factors should have been weaned out already by the GP or the family planning person at the initial prescription.
Okay. So I guess the takeaway here, which is developing to be a common theme in all of our news pieces that we do, is do not be alarmed by the headline of the article. Please do a bit of research of your own. If you think the article is relevant to you, in your own condition, in your own state, just make sure you dig much deeper behind the headline, behind even the content of the article, understand the different types of studies and make an educated decision for yourself, kind of thing. I guess that's what we're saying, Dr. Jenkins, aren't we?
Yeah, and I would concur with that. Yes, in all of us, in all of our lives, we need to make as best informed a decision as we can about anything which influences,
True.
our health. Yeah.
True, especially when it comes to health. Although it seems to be that this is how can I put this? It seems that the people don't make decisions about their health. They react. The majority of them react to what happens to their health. They do.
This is the whole, the whole
Right, like that's
issue about we should be more proactive about our health, taking charge of our health and trying to optimize our health. Yes, it's our greatest possession. The body is so incredibly complex. I still get fascinated by it. When you start thinking about it's the magic of the body and how it functions and the complexity of it, the subtlety of it, the nuances of it. And then it's something that we take completely for granted until it goes wrong. And when it goes wrong, we are clearly devastated by it because you have all of the symptoms of ill health, which makes life so miserable and then can progress and cause significant, morbidity and mortality. And as so much of that can be prevented by healthier lifestyles, or you can stack the odds so much more in your favor by having a healthier lifestyle and, my passion, effective preventive screening.
I think on that note,
Yes.
we're going to end today's episode. Thank you very much, everyone, for watching. Please like, subscribe, and leave a comment if you liked our episode. We will see you on the next one. Thanks for joining from me, Ahmed.
And a very warm thank you from me. Goodbye.
See you on the next one.